Okay, again, we want to welcome everyone to our next webinar, our weekly webinar, titled Stopping the Violence in America. And as we have strolled down this journey to question, to deal, or to come to some resolve through various speakers on the issue of violence in America. We've seen that there's different avenues and different categories that are contributing to the violence in America. And so hopefully through these webinars and bringing on our police force, our different officers and psychologists and social workers and advocates on to discuss, and ministers and people of faith to come on to contribute their understanding, their views, or even their work in the avenue of stopping the violence in America and its roots, and finding what are the root causes, because we can't stop anything unless we really delve into understanding the root causes. Today, I am pleased to have Pamela and Johnson on. And Pamela Johnson is a community activist and an anti-violence advocate in Jersey City, New Jersey. She is the founder of the Anti-Violence Coalition of Hudson County and the co-founder and executive director of Jersey City Anti-Violence Coalition movement, which addresses the needs for public safety through various programs, initiatives that focus on preventing violence and improving the quality of life for the residents. She received her master's degree in public administration in St. Peter's University, where she also received her bachelor's degree in social science, graduating cum laude. Wow, congratulations. Pamela is currently pursuing a second master's degree in communications and public relations at SPU. As a lifetime resident of Jersey City, which is a very important city. Her parents raised her to know the struggles of others and to be able to advocate to those who need it the most. Beautiful. Pamela has spent her career deeply committed to improving the quality of life throughout Jersey City and serving our most vulnerable communities. She believes strongly in investing in the people and leading a progressive movement that focuses on moving communities forward. It is about standing together to do better for the entire community. This is the model for every facet of her life. She believes in it, and God bless you, she lives it. So we want to hear her, our dear sister, as she gives us her synopsis of all that she has been doing through her channel, Anti-Violence Coalition. Welcome, Pamela, for Ms. Johnson, for coming on with us, and the floor is yours.
Thank you so much. Please feel free to call me Pam. I'm happy to be here with you guys today. Thank you, Barry, for the invitation. Thank you, Mr. Oliver, for the warm welcome and, giving that whole beautiful description of who I am and what I represent. So yeah, my name is Pamela Johnson. Lifelong resident of Jersey City, and some other things that was in the short bio. More importantly, I'm a mom, I am a grandmother, and I am simply a resident of Jersey City who wants to see my community improve. And so 8 years ago, myself and some other residents, some who are still working with the coalition to this day, started the Jersey City Anti-Violence Coalition movement, which is a community group. We later on created the Anti-Violence Coalition of Hudson County, which is where our 501c3 is, so we can advocate and make a bigger impact, not just in Jersey City, but throughout Hudson County. Most of the violence in Hudson County is located in concentrated areas in Jersey City. So although we do focus our attention and efforts in areas of Jersey City where violence is concentrated, we still do respond to violence throughout Hudson County to see what we can provide direct victim services for residents who are in trauma and going through just severe, victimization due to gun violence or violence in general. So I guess I can start off like why we decided to jump into this work in the first place back in 2014. We had Detective Santiago was murdered in Walgreens on Communipaw Avenue, and a call went out on social media for a community meeting to address what was happening in our city. It was a very tense time with police. We had other officers from different municipalities policing our area of Jersey City, and it was just a lot of things happening. And so, we Googled because we didn't want to reinvent the wheel. So we Googled, like, is there any anti-violence coalitions in Jersey City or Hudson County? There was no one addressing what was happening in our community. And so we created that community group to address and focus on gun violence and trauma in our city. We started just on the ground talking to the people, wondering, doing, a census and asking specific questions, why do you think violence exists in your community? What are some of the ills in your community that, people tend to lean towards, doing something that will get them in some type of trouble or, danger. And so, we just started talking to the people in those neighborhoods. And I also want to say that all of us who work for this organization, we're all born and raised in Jersey City, and we all live in Jersey City, in those areas where violence is concentrated. I live on Princeton Avenue, and, although if you're on Princeton Avenue, you'll say this is a beautiful, beautiful street and beautiful area, but if you go 2 blocks up, you might walk into the middle of a gunfight. So, we know what's happening in our city because we live there. And so we actively try to make it better. And so, we got the trust of the community because of our consistency. And today, that's why our work actually works, because, people trust us to do exactly what we say that we're going to do, because we've always done just that. So years later, we talked about running programming and what we can actually do to help our community. And then we started our programming. We started the violence prevention programming, the conflict resolution programming, the mediation, going into the schools, the Jersey City public schools and charter schools and private schools, and talking to the youth so we can get them as young as we could, as a way to prevent things from happening. In so many instances, we're always intervening in conflict, trying to de-escalate conflict, but that's somewhat like a police officer. Police are called, after something has happened, while something is happening. In order to really be effective in our work, we wanted to be there before it happened. We wanted to prevent it from happening, because when we get those calls, because gunshots are already firing, somebody's shot or somebody's traumatized from what just happened. So, the bulk of our work is prevention. We just began to take off and do that magical work that was changing people's lives. And we've been doing that work now for 8 years. And part of going in the schools or in, churches or in community organizations and in their meetings and, activating ourselves, we go into the homes, we go into the housing complexes, we go where that violence is concentrated directly on those corners, on those hot spots. We have an initiative called Occupy the Corners, and that's been around for 8 years. And we go directly to those areas where violence is concentrated. For instance, if a little bit about Jersey City and you did a little research, and those areas are like Wilkerson Avenue, Curry's Woods, Ruckards Avenue, Bidwell Avenue, Booker T Housing Complex, Marion Housing Complex, it's a housing complex called the New Houses. So, there are about 16 areas in Jersey City where this violence is concentrated. Some of those blocks are only have one block in between them. So that's how close the violence is, and the groups who are going back and forth with each other. They're very close to each other. They don't live on the opposite side of town. They live in an area where they can literally walk around the corner and see somebody who wants to hurt them. Another program that we recently started was a building trades program. So we always said, going back 8 years ago, that if we had the opportunity to truly change someone's life, how will we do that? What kind of opportunity does that look like? And, you know, as we did work for many years, a job is an opportunity. When you're talking to a lot of the youth and young adults on the corners, you know, they're missing out on an opportunity. They think that, you know, they're disenfranchised from their community. They're not getting the resources they need from their community, and some not in their households because of various reasons. And so, you know, we started the building trades program. We offer free OSHA training. Then they go into a carpentry module, plumbing, HVAC, and electrical, and they learn all about that, and they're certified when they leave us, and then we get them a job, you know, after that takes place. So these are just things that we do to combat violence and decrease the number of residents who it affects, so that people can go on and live a happy and healthy life. I mean, I could go on, but I want to make sure I'm giving you exactly what you need. So if anybody have any questions.
Yeah, I want to thank you for, I mean, you can go on a couple more minutes. You said a mouthful in such a short time, guy. You know?
Yeah,
That
you
was,
know, this is like, we do this work every day. We also have another program where we meet victims at the bedside. That work is funded by the Victim of Crime Act funding, which is federal dollars. And so we have a partnership with the Jersey City Medical Center that, you know, when they receive gunshot wound victims in the medical center, that we're contacted, and once they're stabilized, we meet them at the bedside and begin to conduct an intake assessment and enroll them in our program, because what we're seeing is a lot of recidivism when it comes to gunshot wound victims. You're seeing the same victims from the same locations with similar injuries, you know, and you know, who needs some guidance and some help. And sometimes that help came in the form of relocation. Some folks have to leave Jersey City, depending on how deep you're involved in what's happening on the street. You know, for your safety, you need to relocate yourself, and we help with that as well. You know, if victims are shot, traumatized, and you know, are missing out on work, we complete their applications for the victim of crime compensation, and we assist them in getting their wages and salaries paid for that time that they're out of work, to get therapy and trauma recovery from the TRC if you need some type of counseling. I mentioned the relocation. We also assist with you know, gift cards, ShopRite gift cards, to help our victims and our clients who are experiencing food insecurities. If folks are having issues with slum landlords, we get with the city and the county and make sure that we're addressing their needs with housing. The list goes on and on. We have a lot of programs underneath the coalition. And we do a lot of referrals, you know, and not a referral where we give our clients a piece of paper and send them somewhere, but a referral to where we're contacting, you know, that referral source, and, you know, walking our clients through that, so they're not victimized or further victimized by the system, because that's exactly what happens. Sometimes folks call agencies and organizations for help, and instead of getting help, they get the runaround, which kind of defeats a person, and then they just hang up and don't call back, and they never receive the help that they need to, you know, live a better life. I do see a question in the chat. Are you federally funded? Do you apply for grants? Yes. So right now we have a federal grant and we have a state grant, and we just found out we are the new recipient of the city grant for violence intervention, which is the first grant that the city has ever put into play to address this. And then we also work off of donations as well. Our grants, I think we got our first big grant 3 years ago. So we've been around 8 years. And although the grant money definitely helps us pay staff and, you know, further service the clients, but even when we had to do this work voluntarily, you know, we were still doing our thing. So we're happy to be funded, but definitely we would do it even if we wasn't. But the funding does help a lot. And we do apply for grants all the time. We're working, like, I feel like we never stop applying for grants. We're working on a really big grant right now that we're hoping to get by the end of the year. So, yeah.
Wonderful. Thank you very much for that.
Thank you.
I just had a conversation prior to this with another gentleman who has done things similar to you, and I think a lot of its focus, one of its focus was reuniting recidivism or men who are in and out of the prison system with their families. It helps to curb their risk in returning into at-risk situations. And so we were thinking, as you had just said, and I like what you presented it because you're dealing with the whole community, and that's what we said. We have to deal with the whole different angles of the whole community, different angles to bring some healing to this process. So that will be next week, but I would like to have you again, and we can all get together and start, because if you have a model that is working, it should go, the show should go on the road. And then it's not only that yours is working, but sometimes all these programs are islands on their own, no man islands on their own. They're by themselves. And I think as a nation, and that's what we're trying to do here as a nation, we have to see what works and how we can connect everyone together and work into a national coalition and looking at the best, best scenarios that have proven and look like, in what I'm hearing from you, not only your program has become sustainable, but you can also measure the changes in the people's lives. And that is incredibly important. One question I want to ask you is to go into a new term, recidivism of victims of gunshots. That was a kind of a new one for me. And I'd like if you can just, embellish upon that for me.
So I mean, we usually use that terminology when it's like when we're having a re-entry conversation, as far as like, people going back and forth into the prisons or jails. But that's a word going around right now. But prior to that word being used, I would always give examples to political folks or community folks or, whoever needed to hear the message that there's a particular family called the Rush family. And I grew up with a lot of the Rushes. I'm 48, so, the Rushes who were in their 40s. And they had a lot of struggles growing up and was engaging in a lot of dangerous stuff back then, so 40 plus years ago. And unfortunately, that generational curse is still upon them. So even now, I think as early as the end of last year, beginning of this year, 2 cousins just were murdered. They were, Rush, they both were Rushes, they're cousins, moms, 2 moms, their moms are siblings. And, so that whole generational kind of recidivism, traumatic experience, systemic violence, it truly runs deep in their family. And if you look at the family, and I've talked to a lot of them, it's not because they don't want help. It's because they don't know how to get help. It's been existent for so long within their family, in their household, that they have no idea how to climb up out that deep, deep, dark hole. And and even with because we have to also be honest too about the capability of us as human beings and the willingness of others, or even just folks having that feeling that, I'm tired of this and I know it's a better way and I'm going to try to find it. Some folks, who have been victimized by a system, because this is systemic, by a system that was never designed to see them succeed. It's kind of like there is no picture or no rainbow at the end of the road ever, ever. They don't see light. And, so that's when I say recidivism, that's what I'm thinking of, those generations of trauma, that generation of systemic abuse by, like I said, a system that was never designed to see our people flourish and thrive.
That is really powerful. Thank you for sharing that. And I think one of the things that I've always brought this particular show that touched my heart in looking at the violence and that is systemic within many at-risk communities was, and I guess if I say it, Pamela, you might know it, and it's centered on Jersey City, and it's called 7 Seconds. And I watched all the episodes of that, and that really gave me a deep glimpse of something you just said. A lot of times people don't know how. And people want to, so the want to means that they are viable human beings who are capable of not being victims of recidivism or violence in their families. But what rope do we have to help them come out of that quagmire and so that they can be and it's true in the system it's like a system that doesn't really see their value, so then what's the use, you know? If you keep people in a certain mold, if you will, then you don't reach out in the same way you would reach out to others, so that you can help bring some resolve to the issues that are plaguing our community. And the communities at large, you know, I was talking with Reverend Jenkins, who is the executive president of international president of UPF, which is one of the sponsoring organizations of this webinar. And we were talking about just gun violence in general that's out there. You know, some people just walk up, and just recently in New York, 2 people were just walk up and random just shoot someone in the head. You know, you have that out there, you know, but everything leads back to a lack of love and a lack of values, or the home stems to your community and your homes, no matter what. So everybody in America is a victim to this, whether you're white, you're black, everybody are victims. But as you are sharing with us here, our communities have a very unique angle to address, if you will. And so I'm grateful to that. As you had mentioned, some people have put it already in these nonprofits that are out there. I hope you're looking at them, that might be able to also contribute to your work. But I'm going to stress that we continuously to talk, because something like this needs to go on the road. You know, we can have all these wonderful dialogues, but I think a lot of things that people do say are critically important. And how do we get those insights to the community, you know, and to help you? That's where the rubber truly needs to roll. Anyone else do you have, I would like anyone else to ask you any other questions, Pam? Anyone has any questions that they would like to present to Pam? To Franklin?
Yeah, hello, hi. Ms. Johnson, thank you so much. God bless you for your work. I mean, oh my God, you are really doing God's work. And pardon me, because I'm getting, you know, I'm just coming into the conversation. But and maybe you all have touched on this question earlier. And the question is that, what do you need? And how can we help you? And that's about it. I got a lot of other things too I can say, but I just start out with that first.
Never anybody asked me what we need, and thank you for asking that question.
Money.
Okay.
Money.
Okay. All right, fantastic.
So
Yeah,
I
mean, seriously, so in the beginning, it was, if someone would ask us this, we was like, we need volunteers. Like we need as many boots on the ground as possible.
Right.
And we got that. That was happening all through, you know, the very beginning, and still happening too. I think we're probably like, the volunteers, you know, it's so many. It's like, what do you want me to do? What do you want me to do? And we're like, just hold on, because it's so much to do. We want to make sure we're putting you in the right, you know, area so you can thrive. But money, you know, that is really what we need. You know, when you're working off of grants, you know, grants have a start date, they have an end date. You know, this work, we were a part of the conversation and lobbying in Trenton and in DC to make sure that this work is looked at as a public health concern. You know, violence is a disease, and there are root causes of the disease that cause, you know, other ailments, you know, like stress and high blood pressure and whatever it's doing to you emotionally and mentally and physically, to be, you know, traumatized all day, every day, because you live in a certain area. You know, we want to see that addressed, but, you know, the governor had, you know, he put a lot of money into the budget for the first time ever, specifically for violence prevention. And that's how we're able to run the building trades program. You know, the VOCA money, the Victim of Crime Act money that we have the partnership with the hospital, that money is going to run out. You know, we just lobbied for $10 million in every site across New Jersey, violence intervention site, so we can have that money from ARP dollars. You know, that money, I don't know if you know anything about ARP, American Rescue Plan. That money, you know, was written into the budget by Biden once COVID and everything happened. And it is for violence prevention, because they found out that in COVID that there was an increase in violence across the state of New Jersey. For various reasons, right? One, you're going crazy, being quarantined, and everything is just moving and too fast or whatever. But when that money runs out, we're back to scrambling, you know, for funding. You know, prior to receiving our first grant 3 years ago, everybody was working voluntarily. We got maybe micro grants from the city, probably like 3,000, 5,000 to host an event, run an event in the community, but there was nothing for folks to get paid to do this work. Now we have a staff of 8. Out of our staff of 8, we have 4 full-time and 4 part-time. They make a livable wage, a good wage, and we're able to, you know, employ people from the community to help people in the community, right? You know, but we're always scrambling when we get close to that grant being, you know, coming to an end. So we're always looking for funding, always looking for donations, no matter how big or how small. We're always looking to make sure that we can sustain this work, even if we don't have a grant, you know, underneath our belt at the time. So yeah, thank you so much.
Yeah, so thank you. So yeah, that's why I said next week's program will be focused on going on the road, how to do that, and taking these models on the road. It just needs people. It's interesting that I had this conversation with Reverend VJ Smith just the 2 hours prior to this. We said that our next program should be, how can we get the funding to put these on the road, these type of projects on the road, joining together with them, merging some stuff together and going city to city. And that kind of funding is very much needed as well. So I thank you for that. I think you have a great model, you know, and there's some, you know, some different points. It seems like you, as time in those 8 years you went on, you left you try and leave no stone unturned, if you will. And that's critically important. So we want to thank you. Anyone else, you know, anyone else like to share? How about I see our sister here also. You know, I'm gonna call you Dr. Alexander, who has played a critical role, Pam, in our all these meetings. How you doing, Dr. Alexander? And if you can introduce yourself, I'd like to hear from you as well.
Greetings, everyone. I'm Dr. Amanda Clark Alexander, and I don't have a question, but I want to commend Ms. Johnson for the work that she's doing, because I hear her heart. As you all know, I worked in the prison system for 13 years, and for her her to talk about having boots on the ground and to be in the middle of it. That is commendable. It's to be commended. So I just wanted to commend her. And I clearly heard her say, which is so powerful, everybody in this situation don't want to be in this situation. So the question becomes, how do they get out? I appreciate the fact, House of Judah, we used to do more than a message where we would give bus passes for people to be able to leave the state. We would give bus passes for people to be able to get out of their environment, because you're in a situation, you're released from a situation, and you have to go back to the situation. So I commend your program and all the work that you're doing. As we move forward, I'd love to continue to speak with you in some other, in that vein of what's next. And as Reverend Oliver keep me informed, I'll be praying for you in the meantime and in between time. Much love for you.
Thank you so much, Queen. I totally appreciate that. And prayers is definitely welcome and needed and embraced over here. Thank you so much.
God bless you.
Thank you. Thank you so much. I appreciate that. That was sweet. Anyone else like to, any points, or how about, I would like to ask Barbara Mosley. Now, Barbara Mosley Marks works more into her career in character education, which is helping, you give people jobs, you get them out, you get them to a point where their desire is to come out, and you start providing a platform. But also we have to also play a critical role, Pam, in the recalibration of their values, because they have been succumbed to the subculture. I say our subculture in those those projects in that area, value system, which they knew weren't right, but they're still attached to it in some way. So how do we help them to elevate their consciousness and insights and their value system to the point where they can be sustainable participants in all the blessings and graces coming through them through your particular project? So I don't know if I put Reverend Barbara Mosley Marks on the spot, if she would like to say something in the area of character education.
You certainly did, my brother. Can you hear? I seem to be going from one Zoom meeting to the next, so I'm sorry I just got here. And I'm not quite sure what was discussed before I came on. I'm in the process now of trying to resurrect the character education program here in Virginia because I lost the status. I got sick and was unable to maintain the status, the paperwork, for the state level. And so I'm in the process of trying to do that again. In the past, we have done a number of things. We have done hunger projects. We have done character education in terms of teaching people their value, how they present themselves. Because if you're going to apply anywhere for a job, you need to present yourself in a way that would tell the employer you're right for that job, or at least give them the courage that they can rely on you in whatever capacity you're applying for. Also, how you tell people, you actually tell people how to respect you by respecting yourself. And that's a process we put them through. It's a 6-week program where you understand how to present yourself, what's your value, how to respect others, etc. But I'm in the process of, as I said, of getting that organization. It's called Pure Style, which sorry, I've got so many things running through my head right now. It's not funny. The the bottom line of that, pure style character education means purity can be stylish, which means when people hear the word pure, they go into a mode of pure. I mean, that's not cool. But pure in fashion, pure in your value, pure in the way you project yourself, pure in the way you speak to people, because our language also needs to be changed. The way we speak, we don't want street speak. We want to be able to project ourselves as a person of dignity. And even to do that, there is a process that needs to be experienced and be taught. Of course, these things should be learned in the family. But most times, children or young people come from broken families, and the parents, or most likely a single parent, didn't experience that in their family, and so they can't teach what they don't know. And so that's what we're trying to help equip people with. We've done it for adults as well as young people. So that's all I can offer at this point. I need to get that program back on track, and then I can move forward.
Thank you very much, Barbara, for that. Saw a message from Leslie Rickney, and says when people are in survival mode, they can't think straight. And Pamela, it's a great point. But what we're discussing here, as I was listening to Pam's presentation, you might not have heard it all, but she has had different platforms that they've created that will be almost servicing the whole person, or whatever particular trauma or particular situation in a traumatic experience that person might have experienced, and then helping them, lead them and coach them, or to help them from that to the point that they want to be helped, or they will accept help. Then the character education piece can come in.
Right.
But when they're in a traumatic mode, it's impossible, that is not applicable or appropriate. Right. What do you think, Pamela?
I mean, I definitely agree with you. It's hard, I think Leslie, she said, she made a great point in the chat, where she said when people are in survival mode, they can't think straight. I mean, you're thinking about surviving, you're not necessarily making the proper decisions, or even, having the ability to have a proper conversation. I've attempted to help people, but it's so what's going on in their life is so chaotic that we have to pause for a minute, and instead of me talking or listening, we just have to sit in silence. And so, you identified individuals when they come see us, we identify, what is the best pathway forward, and we carve that out. And sometimes it's just quiet for a minute, or so, until we can kind of breathe and think a little bit, not even a lot, just a little bit, so yeah, definitely agree with that.
Along with what she just said, in support of what she just said, the reason that the Hunger Project was created years ago was because children who are hungry, they can't study. You want to help children and young people, help them prepare for the future. But if they're hungry, they can't study. And so that's the reason why the Hunger Project was created. The parents were allowed to come and get food, etc., for the family, but individuals were not allowed to participate in that program because it was mainly for the young people, children specifically at that time. Because if they're fed, then they can study. It's like, as Pamela just said, it's a form of trauma. If you're hungry, you can't study. And so that was the reason for starting that program. And it did work. But I had to leave to go overseas, and I asked someone to keep it going while I was gone. He did nothing. And so when I came back, we couldn't do that because I also moved out of that state. My office was moved. So anyway, hopefully we can start that again soon.
I see, thank you, yeah, for that. That was great. I see Reverend Jenkins is on. Dr. Jenkins, this is Pam Johnson, who is, as you've seen her bio, and she's an anti-violence advocate and is doing extraordinary work in Jersey City. And of course, I was even moved more because Jersey City had was a critical impact on me from that program, 7 Seconds. That thing just did something to me. So I'm really grateful. All right, thank you, Barbara. With Creech, thank you for that. All right, Reverend Jenkins, how are you? Welcome.
Oh, great. Thank you, Dr. Oliver, and thank you, Pamela. This is just so helpful and so hopeful. We'd like to work together with you. We can talk about it later. We're really honored to have you here. And I'm just really wondering do you see a trend now getting better, or is it getting worse in the community in terms of violence? Because sometimes it's exaggerated by the media, which also can create a feeling of hopelessness. But I've made that connection. We're working all over the country, and there's some very positive things that people like yourself are doing that make a huge difference. Or what's your feeling about the trend right now? Is it getting better in general, or is it getting more hopeless or difficult? And what's your thoughts on that?
Well, thank you for your kind words. And as your question, so I think as a country, it's gotten worse. As overall as a country, I think as a city, in Jersey City specifically, it's gotten better.
Good.
I say that and not just because of us, although we were the catalyst, but there are other organizations followed suit. There are other orgs who are addressing maybe not violence itself, but addressing some of the root causes of violence that assist in what we do here, because that's what we do. We treat the root causes. We know what they are: poverty, a lack of quality education, lack of access to health care, mental health, all of that stuff, right? Unemployment, systemic problems in your neighborhoods, that whole broken windows effect. So we know the root causes of violence, but there are a lot of orgs who have sprung up, like the trees that we needed to provide us some shade by addressing those, systemic root causes that really help us out once we become connected with a victim or an offender too, because we also have clients who are perpetrators. We help them in a different kind of way, but we do assist perpetrators because they need help as well. So we want to make sure that we're providing a wraparound system. So, but I definitely, and even Mayor Fulop and Director Shea, the public safety director, they also, in an article, gave mention to our organization, the coalition as a whole, for helping to decrease violence in Jersey City, and providing support, direct support for victims and their families. And because one thing that we do, we don't just help the victim, the person who was, had the act done to them. We assist the entire family. We believe in that mentoring component where you're not just mentoring a youth, but you're mentoring the family that youth return to once they finish having a good time with you outside of their home life. You want to mentor the family, so you're providing that wraparound system.
How have the churches in Jersey?
Did you say how are the churches in Jersey City?
Your work directly. We know a lot of pastors in Jersey City. In fact, one of our executives, Gabriel Rapata, is pastor in Elizabeth and has lots of connections in Jersey City. So we'd like to help people connect to us. Not all of Baptist Church there in Jersey City. long time.
Yeah, we're connected to a lot of the churches. I think in most cases we find ourselves assisting the churches. So a lot of our churches are not necessarily connected to the outside of the building that they're in. And so, we're there to assist in that any way we can in any capacity. But then there are churches like World Outreach Church under the leadership of Pastor Sharon Richardson and his wife, Pastor Rebecca Richardson. And like they are fabulous with, doing so much work in the community and in any capacity when it comes to serving the people. But they do believe that church is about being outside of the building and not necessarily inside. So there are a couple of those churches who you can see occupying the corners with us, or, we're having rallies or marches in the streets with us. So they do exist, but we have a great relationship with all of them. And we're usually in them several times a year doing some type of function.
That's fantastic. We're very strong in that area, Jersey City, Elizabeth. We really need to connect. Come visit.
Absolutely. I put my number and my email in the chat. Please feel free to save my contact information, and anybody who wants to reach out, can definitely contact us at any time.
And how have the police been? What are some of the good things about police in your
So we've been working with the police for a very long time. They're definitely one of our allies. We work with the prosecutor's office, with the police, with the court system, juvenile and adult, with municipal and superior court, and have great relationships because they use us a lot as a system of support when they're thinking about sending youth and young adults to detention facilities. So we definitely work well with them, but they do understand our feelings around public safety. For one, we believe that public safety is not public safety if it doesn't involve the public. So if the community is not having, something to say or input or assisting with the planning or strategies around policing their communities, then it's not public safety. We've never used the word defund the police, but we would like to see public safety budgets cut across the state of New Jersey because they have the biggest budgets. And if you're going to take money out of any place in any urban city, it's usually policing that you got to take it from, because that's the biggest budget. So we do believe in a holistic community-based public safety, and down from the chief of police, Chief Flora and Chief Moody, they know how we feel, and we work around that because we want them to understand that we're providing a system of care. We want, and we know we have to incorporate police in what we do. However, we don't want to be a over-police city. We don't want, when we talk about violence and crime, we don't want the only, way to prevent or decrease that is to put more police on our streets. We don't want that, because in urban cities across America, where black folks live at across this country, we are over policed in our own communities. And it could be better if you involve the community to help the police do that prevention work and that intervention work. So, we work very well with them, but they definitely understand where we're coming from.
Well, that's great. No, we feel the partnership is critical. Everywhere where there's a good community police partnership, crime gets reduced, and more officers, actually less police on, in terms of arrests and all that are needed, because crime is being prevented at the root cause stage, and that's crucial thing. I think what we need to do is learn more of what you're doing and see how we can partner together, and we want to do that across the country, everywhere, because stopping violence really has to get to the root of where people decide to take a physical action against somebody else. And are the majority of your experiences, are they with families mostly? Most violence actually is in the family a lot of times. Sometimes it's unreported. A lot of the police calls go to domestic problems. And then there's drugs and alcohol also contributing. And then there's, you know, outside of the house, outside of the family. Where's most of the violence that you're dealing with, you know, really rooted?
Most of the violence that we deal with is interpersonal violence. So people who know each other from the community, that maybe they went to school with each other, maybe they live around each other. They're not exactly friends. But it's that group, or I don't call it gang violence. I'll never call it gang violence. People use terminologies for gangs so they can get more money into the police budget, you know, for artillery and stuff like that. So we don't use that terminology, but it's group on group violence. You got kids from one area, you know, beefing with kids from another area because of some 12-year-old beef that they don't even know about. So that's most of the violence that we see. And then secondly is domestic violence with domestic partner violence.
So the interpersonal violence actually is very high on the list. So we have, you know, we saw a situation years ago, and it's going on. We're working with some of our allies and friends in Chicago. One person's name is T. Cooks, and T was the gang leader about 18 years ago, and he came out of it. And fortunately, he never hurt anybody directly in a life or death way. He never killed anybody. But he completely reformed, and he's doing an amazing work there with young people. But his whole thing is that, you know, so many like in Chicago, if you remember what happened back years ago, it's kind of a case study now. They decided to, you know, arrest all the leaders of the different groups, and they did. But what happened was there was then no leadership and nobody to talk to.
At the next stop sign,
and the groups split up into smaller groups, and then it got worse. It got a lot worse. And this interpersonal thing, I think it's a culture also that we're dealing with, where people have become more you know, more quick to not care less whether they're hurting somebody or not. They're just gonna take action. So what happened was Congressman Danny Davis, a dear friend of mine, his grandson had traded with a very good friend. His friend and his girlfriend traded, you know, some high-end sneakers for some, you know, sweat clothes, really nice Supreme sweat clothes or something like that. And they got upset. They got in a fight in the, you know, entryway of his house. Danny Davis, his grandson. And the fight was over. They wanted to trade it back. They weren't happy with the sneakers or whatever. And they got in an argument. They're both all in high school together. And then he said something, and the girl felt insulted. And then she told her boyfriend, "You're not going to let him talk to me like that." You know, and then it got worse and worse and worse. And she pulled out a gun, gave it to her boyfriend, and said, "You can't let him treat me like that." And she egged him on, and then he shot the kid in the head, and he died. And both of them are in prison now. Congressman Davis really was very sad, very, very sad. But also it happened right in his grandson, his son's home. You know, and that was friends that went off in anger. So how do we prevent that? How do we work with young people to stop this anger and then turning to a gun to resolve the problem?
I mean, that's a loaded question, because it's so many, I mean, prevention is key, but also early prevention is key. I mean, there's a group of Moms Demand Action. I don't know if you heard of them. They're national in the state of New Jersey.
I have, yeah.
And probably other places too. We work very closely with them. And, you know, their main focus is gun laws, right? So that's it. Guns are definitely too accessible to certain people who should not have a gun. You know, then we're working with the prosecutor's office, and we've been doing that for many years, trying to figure out how we can stop folks from trafficking guns across state lines, and working with other states and municipalities to figure out how we collaborate to do that, because a lot of guns are coming into our cities across this country illegally. And then you have that mentality where you need to address systemic and generational things happening in families. And then there's a component where there's a mental health issue, that's gone unaddressed. Some because of accessibility, some because people don't really talk about that a lot of times in different households, right? So it's a lot of reasons why violence exists and why people do, what they do. And it's just important to separate those things. So you're making sure that you're addressing each individual issue and not thinking that violence happens because of one thing. It happens because of so many things. My girlfriend, who lives in Raleigh, North Carolina, 3 weeks ago had to bury her 18-year-old son. And not because he was into anything violent, and not because he was in a group or gang involved thing, because his best friend, since he was a child, killed him and then took his own life. These are two 18-year-olds who, they knew that he was having some type of mental break when COVID first happened, but it could not be addressed because COVID was happening and everything was virtual or, telehealth, and it wasn't working for him. And so he finally erupted and called his best friend to meet him for lunch, and he shot him in the head, and then he shot himself in the head. Because he knew that day he wanted to end not only his life, but he wanted his best friend to go with him. And that literally just happened a couple of weeks ago. So there are all type of reasons for violence. It's just important that when you have a specific case in front of you, you treat it as an individual case and you provide the necessary help and support that's needed for that individual case.
Thank you. Thank you so much, Pamela. Reverend Oliver, thank you for this great program. We're so grateful for Pamela right on the front line. Whatever we can do to help, Reverend Oliver, I'm in full support. Thank you.
Thank you. Thank you very much. Thank you so much. And, thank you, Pamela. That was really great. Thank you, Reverend
Thank you for
Jenkins.
having me. I'm going to have to jump off, though. I have a hard stop, y'all. I'm so sorry, but I really enjoy being here. And please, anything that you need, anything you might want to know, or if you want to invite me somewhere just to be in the room, I don't have to speak. I love being amongst people who are, working towards one cause, right? Or just for something that would benefit not only the coalition, but the world as a whole. And so, peace is definitely that umbrella that I fall under. So I'm willing to support or just be in the room at any time you guys feel a need for me to be there. So thank you.
So as I said, Pamela, we had a wonderful conversation this afternoon, and I think you fit perfect in that, because we would need your wherewithal to help facilitate that. As that Reverend Jenkins said, we want to go across the country. So I'm not going to hold you. I want to thank you very much, but I want to say this one point. God has blessed you for that 48 years. You sure look good. You look great.
So much.
And when you mentioned grandchild, I said, did she have babies at 7 years old? So God bless you.
I have 2 grandchildren. My oldest she just turned 5 yesterday. And then I have an 8-month-old, both girls, and they're both my daughter's daughters, and my daughter is 30.
Oh my God. My goodness.
I'm 18.
18. Okay.
And my son is 24 with no kids, and hopefully he'll keep it that way for a while.
Well, thank you very much. I will be contacting you.
Thank you so much.
Quick question before she goes.
Yes.
Can you put your contact information in the chat?
It's already there.
It's already there.
It's already there.
Thank you.
Yes.
Thank you.
God bless you, Pamela.
God bless you too. Have a good day. Thank you so much.
Okay, thank you. Bye-bye.
Have a blessed one.
Yeah, you too. Beautiful.
Yeah, she was great. So it's already 1 minute to closing. I want to thank everyone again for coming. All the participants, all those people asked questions. As I said, next week I want to have VJ, because I had a very succinct conversation. Actually, how do you implement? He has a proposal similar to hers, but how do you take her and others who are doing sustainable work in the area of violence and guns and all of that we're discussing on the road, city to city? So he's going to have, we're going to have a discussion on that. And he has a wonderful proposal. So again, brothers and sisters, those who are not here on the Zoom, those who are out there live on Facebook or whatever, we greet you. We thank you also for coming on. And we look forward to seeing all of you next week. God bless you. And we'll see you next Wednesday, same time, 2 p.m.
Thank you. God bless you. Thank you so much.
Thank you,
everybody.
Barry. Barry, you were great. For that.
Right. Good to see you, Reverend Geller.
Hey,
Thank you, Reverend.
Yeah,
Yeah.
Reverend Geller.
good to see
Hey,
everyone.
Can someone
Dr.
help?
Jenkins.
Can someone help me with the
Thank
contact
you. Hey,
information?
thank you, Reverend Franklin.
All right.
Thank you,
Always-
Reverend Geller. What a great lady to me, Pamela.
Mm.
Great.
She was
Barbara,
awesome.
Reverend Oliver will give you the information.
Okay, wonderful.
Yeah, we have her. So
I'll call you right after because I also have a question or a comment for you.
okay, sure.
Thank
Yeah.
everyone and God bless. And let's keep in mind, she said over the world, it's getting worse, but in Jersey City, it's
Mhm.
right there should reign supreme in our mind. And we have to keep in mind that order comes out of chaos. We're going to get there. It's going to get better before it get worse.
Yes.
Yes.
Amen. Amen.
All right.
All right.
Hallelujah.
Yes.
All right. Thank you again. God bless.
Thank you, Dr.
Dr.
Alexander.
Alexander.
Yeah, thank
It's
you,
always a
Reverend
Hey.
pleasure
Oliver.
to see you.
Yeah,
Smooth as
beautiful.
silk, brother. Smooth as
There
silk.
you go.
Dr.
Okay, bye-bye.
Okay.